Welcome to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness throughout your journey in life. Your host is Dr. Emran, a respected physician who's treated thousands of people just like you over the past 10 years. Listen to the show each week on iTunes, iHeartRadio, Spreaker, and 3 and Out Radio Network. Information provided on this show is not a substitute for professional medical advice. Always discuss your questions with your doctor or go to your nearest emergency room immediately.
Thank you so much for joining me today on Simple Health Radio. I'm your host, Dr. Emran. On today's episode, we have some very special guests. I have Victoria and Rosa. These are local students who are interning on our show, and both of them have some questions about different medical topics. So we're very delighted to have Victoria and Rosa on the show today. So Victoria, we'll start with you. Tell me about one of your family members. They had a recent emergency department visit.
Right, yeah. My grandma, who's 75 years old, was recently... She had to go to the ER yesterday, and she was having trouble breathing, and she has like high blood pressure, so that was like why she had to go.
Okay, very good. So your grandmother, she was at home. She was about 75 years old, so she was having difficulty breathing. And was it for a couple days or longer? Do you know?
No, it just happened like within like those couple of hours.
Okay, so it was a very short amount of time. Do you know if she was sick with anything, like a cough or chest pain?
No, not that I know of.
Okay, excellent. And then did she go to the hospital by herself, or did someone have to take her there?
No, we called 911, so she had like an ambulance take her.
Excellent. And that's always the right thing to do. So anytime you have a family member, whether it's an adult or a child with any type of breathing problems, chest pain, dizziness, the right thing to do is call 911. I don't recommend you drive them yourself because you get stuck in traffic or they change their mind and they don't want to go to the ER, but you can definitely save their life by calling 911. So tell me, when the patient or your grandmother arrived at the hospital, what were some of the vital signs? Did they check her blood pressure there?
They did, yeah. When she arrived, they checked it, and her blood pressure was at 218.
Okay, so 218 is very high. That's the top number, which is the systolic number. Normally, we like to see it to be about 120 or 130. So if she's at 218, that's double the amount that it should be. And then it sounds like they did some testing, some x-rays or other exams for her. And what did they find? What did they explain to you?
Well, they just did a CT scan on her just to make sure she didn't have like what's it called, like a pulmonary embolism, right? But they just figured out that she didn't have any blood clots or anything, and it was just fluid in her lungs.
Okay, excellent. So x-rays and CAT scans look at the lungs and the chest area. And CAT scans are always preferable because they're three-dimensional, and they can help us to find out if there is a blood clot, because a blood clot is life-threatening. People with a blood clot in the lungs can die within minutes if they don't receive care properly. So I'm glad they did that. And you mentioned that they found some fluid on her lungs?
Yeah, it was the reason that she was having trouble breathing a lot. I guess there was too much in there.
Okay, very good. And then did they measure the heart size? Did they describe anything about the shape of the heart?
They didn't tell me. They just said it was enlarged. So
okay,
I'm not sure how big.
All right, very good. And then I'm assuming they admitted her to the hospital?
Yes, they did.
Okay, very good. And has she gotten better or worse, or how is she feeling today?
She's a lot more stable. They just have to monitor and see like how her blood pressure is doing since it was so high. How her heart is doing with all the medication.
Very good. I'm glad that she got the care that she needed. So based on what I'm hearing, my suspicion is that your grandmother, she had an enlarged heart, which is called cardiomyopathy. Another term is called cardiomegaly, but I believe she has cardiomyopathy. And the medical term, if it's chronic, is called CHF, which is congestive heart failure. So congestive heart failure occurs over time. The number one cause is high blood pressure. So even people who take their medications every day, they're compliant, they watch what they eat. Over time, the heart muscle stretches so far out because of the blood pressure being high, it actually weakens it. So the walls of the heart have to be elastic. So they have to stretch and then contract. And that's how a heartbeat is actually conducted. When they stretch too far out, kind of like a rubber band, they can't push back and it's not able to pump out the blood. So the heart keeps on getting bigger, like a water balloon. So if you keep on filling the water balloon over and over again, you feel how boggy it is, and if you drop it, what happens to a water balloon? It's going to pop. Exactly. Now, just like a water balloon is filled with water, the blood also is composed of water. And so if the heart is not able to pump out the blood quickly enough, it has to go somewhere. And so the lungs, left and right, are surrounding the heart. So that fluid actually backflows. And we call that edema. So it's not blood, it's not pus, it's none of those kind of things that are leaking into the lungs, but it's called edema. So when people have edema in the lungs, it's called pulmonary edema. And on an X-ray or a CAT scan, you can actually see it because it has a different density. And so my suspicion is that your grandmother may have been sick for a little while, maybe a few days or a week before she called the ambulance. And my guess is that the fluid kept on building up, almost like flooding in her basement, but her basement was her lungs. And so when she would take a deep breath, the liquid that was there prevented her from being able to oxygenate. And so she came in with that symptom of shortness of breath. Now, the best way to get rid of that fluid is going to be with a medicine called a diuretic. So a diuretic is a water pill that comes in different forms. Some of the common names are Lasix or furosemide, and there's several other ones, but we like Lasix and furosemide because a low dose can be given IV or by mouth. So let's say the patient is unconscious or they're not able to eat, their appetite's really, really bad, they're vomiting. We just give it IV. And within a few hours, it'll start to work. Now, what happens with the diuretic, it's actually going to take that blood, the liquid out of the lungs and so forth, circulate it through the blood and send it to the kidneys. And then the kidneys become more efficient. And now it's going to sound kind of weird, but that person actually urinates more and they actually pee out all of that extra fluid, the edema. And we were talking a little bit earlier, how much fluid do you think that your grandmother excreted after taking this medication?
It was around 2.4 liters.
2.4 liters. So if you go, that is a lot. So if you go to the grocery store and you buy a 2 liter of Pepsi or Coca-Cola, think about how much that is. You can't drink that much in one moment. You know, you even if you put a straw and you try to drink your favorite drink, you're not going to get very far. But that much liquid was accumulating. It was extra on the body. And so her kidneys had to get rid of all that. And my guess is that hopefully by tomorrow, once all this fluid is gone, she'll be up, walking, talking, back to her normal self. And then the doctors will probably send her home. And maybe they'll give her a prescription of the tablet form of the water pill, the diuretic. And then hopefully she won't get sick like this again.
Can the diuretic be used as diet pills? That's
a very good question. So diuretics are used as diet pills. And there's 2 categories of that. One is the prescription one that we just mentioned, so Lasix or furosemide. Many people use it at a low dose. So a low dose of that can actually get rid of extra fluid that builds up, sometimes hormonal causes, sometimes after surgery. People retain fluid after having a baby. They may retain fluid. So as a doctor, I can prescribe that medicine to help you lose weight if that is due to a fluid cause, which is the overweight from the edema. Now, over the counter, they also sell diuretics. And there's companies like Midol and some of the other ones that do make medications for like migraine headaches and cramps and so forth. They actually have a low dose diuretic in them. So over the counter, some people will use diet pills or they will use things like Midol and so forth, and it works for them. It's at a low dose. It is safe, but there are a couple of side effects. So if you take too much of it and it's hot and humid outside, you'll actually become dehydrated. And so if you're urinating, and you can't drink enough water, you're going to become very dry. So your blood pressure will drop. Your heart rate will go up and people get dizzy. They may not have shortness of breath, but they'll be very dizzy. And when they come to the emergency room, then we have to rehydrate them. So all the fluid that you lost, we have to poke you in the arm and give you 1 liter or 2 liters of IV fluids to replace that. So you're correct. Diuretics can be used to help with dieting in the right case. So you have to use that very cautiously. Other questions or?
None that I can think of.
Were there any symptoms that your grandmother had, or did it just occur spontaneously?
I think a lot of things built up to it. It's probably just because she had surgery recently because of her hip. She had a total left hip replacement, and so she was always in pain, and we just figured that it was from her leg, not like having trouble breathing and chest pain and whatnot.
And that's a very good question. So typically something leads to another, and sometimes the simplest thing can cause the biggest problems. And it sounds like maybe a month or 2 ago she had gone through surgery for a hip replacement. Hip replacement is a very complex surgery, so it probably takes weeks to recover from that. You don't feel very well. She may have been on pain medications, and so she may have gotten her medication mixed up also. And when you're lying in bed, it's natural that you're going to retain fluid because you're not able to walk and get all that circulation, throughout your body. So that's a good point. I'm glad you asked about that. Do you have any other concerns or thoughts or questions that you want me to ask about or answer about your grandmother?
Yeah, so when she was taking a lot of painkillers, her voice was very her train of thought wasn't as flowy
True.
as normal.
True.
And I guess it was almost as if she was on anesthesia, right? Because she was acting all loopy and whatnot. But I don't know if that's normal for painkillers.
And that's a very good point. So what you're referring to is called sedation. So whenever you take strong pain medications, either after surgery or after going to the dentist or just for a headache, many people feel drowsy, and most people sleep it off, and then that medication is out of their system. So typically most pain medications will last for 5 or 6 hours, and then they're supposed to be gone. But if you're taking them 2 or 3 times a day, they build up in your blood, and so people become sedated. So they forget what time it is. They wake up in the middle of the afternoon. They think it's nighttime. Then they wake up at night. They think it's daytime. So it's almost like being jet lagged. And what you described is very common in older adults because their ability to metabolize medication is compromised. And so one pill may last for 12 hours instead of being just for 6 hours. And I think the pain medications were maybe too strong for your grandmother. And I think that also caused some side effects for her. So whenever she does leave the hospital, my guess is they're going to try to reduce her medication so she's not as sedated in the future.
Right, yeah. She was taking it every 4 hours, so
Correct.
It was quite a lot.
And she may have needed it that much, because as I said, any type of surgery can be very, very painful, but we have to always respect, that people don't die from pain, but they can die from painkillers. So we have to be very cautious with the dosing, the frequency, and hopefully when she does see her doctor, they can address that. And I always say to my patients, less is more. So less medication is more beneficial because the more medication you take, the higher the chances you're going to overdose by mistake or have a drug interaction and cause some major problems. So medications do their job. Certainly they have an effect, but they also have a side effect. And I think that may have contributed to your grandmother's situation. All right. Excellent. Well, thank you so much for joining me on today's episode. This is Simple Health Radio with Dr. Emran. I want to thank Victoria and Rosa for being on the show today. We discussed cardiomyopathy as well as congestive heart failure. There will be show notes and a blog that go with this episode so you can read it online. Follow us on social media and visit our website, simplehealthradio.com. I look forward to having you on a future episode.